Let's get started on today's webinar. Please sit comfortably. If you're sitting on the floor or on the chair, please ensure your head, spine, and your neck is in the straight line. Hands on mudra, if you are aware. Otherwise, just place it on your knees. As we always do, let's start this webinar with the blessings and guidance from all the gurus. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Param Brahma, Tasmai Shri Gurave Namaha. Akhanda Mandalakaram, Vyaptam Yena Characharam, Tatpadam Dashitam Yena, Tasmai Shri Gurave Namaha. Dhyanamoolam Gururmurti, Poojaamoolam Gururpadam, Mantramoolam Gururvakyam, Mokshamoolam Gururkripa, Mokshamoolam Gururkripa. Take a deep inhale. While you exhale, chant Om 3 times along with me. Om. Om. Feel the vibration of the mantra and the Om chanting. Feel the calmness. Observe the vibrations. Visualize the lotus feet of your guru or your favorite god. Surrender your pranams. Gently bring your hands, rub them to generate some heat. Place the warm hands on your eyes and gently open your eyes. Hari Om, everybody. Hari Om.
Hari Om.
Hari Om.
Hari Om, ma'am.
Welcome you all to today's webinar.
Hari Om.
My name is Kavya. My name is Stotra Rupam. Hari Om. Are you all able to hear me? Are you all able to see me?
Yes.
Between getting muted.
It is getting like, kind of there is a disturbance, like
Yeah.
breaking. I thought it was only at my side, so I was little hesitant.
You are not. Okay, let me
Ma'am?
Yes, thank you for letting me know that, I'm just trying to get the best network. So there will be, clarity in what I'm communicating.
Right now, it's okay, Kavita.
It's okay, is it?
Yeah,
Okay,
right now,
great.
I am not getting any disturbance.
Or somebody
Right,
says,
right now it is okay.
okay, great. Okay, so let's get started. You're still able to hear me, right?
Yeah,
Okay. So
the
my name is
video is not
Kavita.
on. Okay.
Video is not on. So for all of you, those of you who can see me. Sorry for the technical glitches that we have. Okay. Again, let me take this opportunity to welcome you all to this webinar. And on a Saturday morning, especially during pre-festival time, I see 57 of you are, logged into this webinar. Our sincere gratitude for your time and effort. Let me share my screen and get started. As I mentioned, I come to know that many of you from a yoga background. It's okay if you are not also. We'll cover the basics and then we can drill down into details if you're interested. Okay, so let me share my screen. Let me know when it's available for you. Are you able to see my screen now? Coming up?
Yeah, it's coming up.
Thank you. Just to double check, what do you see on my screen?
Shivdarshan Yog Vidyalaya and lineage of gurus.
Wonderful. I just like to confirm that's the whole thing, right? So we have a reciprocation. We ensure that what we communicate comes back in the same form. That's a methodology. You will see that it's followed at Shivdarshan Yoga Vidyalaya. I would like to introduce our lineage here, the Guru Parampara. You see Swami Shivananda Saraswati, which is the first picture in black and white. And next is Paramahamsa Swami Satyananda Saraswati. And you also see Swami Niranjananda. And in the below picture is Swami Vajrapani Saraswati and Swami Gambhirananda Saraswati. So under their guidance, these people have made a remarkable contribution to the mankind. They have surrendered their life. They have worked for the welfare of the humanity by bringing yogic practices into the lives of the human being for the mankind to live in a healthy, happy, and a harmonious way. Each one of them have researched on the problems that the humankind is facing and come up with solutions, guidances that they can follow for a happy, healthy, and a harmonious life. We are all blessed that we are in this generation having reaping the benefit of their efforts. Swami Satyananda Saraswati is the founder of Bihar School of Yoga. Swamiji said many, many decades ago that yoga is the heritage of yesterday, the science of today, and the culture of tomorrow. It is true. Now yoga is the culture. Swami Vajrapani and Swami Gambhirananda are direct disciples of Swami Satyananda Saraswati. Swami Vajrapani joined Bihar School of Yoga in 1967 and was initiated by Swami Satyanand Ji himself in 1969. He was handling various activities at Bihar School of Yoga, including the construction of Ganga Darshan building, and he founded Shiv Darshan Yoga Vidyalaya in the year 1992. Swami Gambhiranand Saraswati joined Bihar School of Yoga in 1979, initiated by Swami Satyanand Ji also in 1983. And she was heading various activities in Bihar School of Yoga, and she's the Acharya, senior Acharya at the Shiv Darshan Yoga Vidyalaya, and heading all its activities. Shiv Darshan Yoga Vidyalaya is located in Chulai in Chennai, and is having a space of around almost 6,500 square feet, providing facilities for yoga classes, research, and many activities. Previously, there used to be a lot of offline. These courses used to be like offline courses. Now we do.
My voice not clear, ma'am.
Yeah, audible, not audible, right?
Yes, sir.
I'm not able to hear. Is everybody able to hear?
No.
But I am also not able to hear.
Kavita, we lost audio.
Are you able to hear me?
Yes. Now, yes.
Swami Satyanand Saraswati was born in Almora in 1923, and he attained Mahasamadhi in 2009 on 5th December, midnight of 5th December. Swami Niranjanand Saraswati, born in Rajnandgaon. He's the current head of Bihar School of Yoga. He was born in 1960 and took sannyas in 1971. He's traveled extensively across the world under the direction of Swami Satyanand Saraswati. Shiv Darshan Yoga Vidyalaya is run by the senior most Swamijis from the BSY, Munger. It is a 100% charitable organization. It was founded on July 14, 1992 by Swami Vajrapani Saraswati. And it was inaugurated by Swami Niranjananda Saraswati in 1999. Swami Gambhiranand Saraswati is the Acharya of the Vidyalaya and who designs all these courses and taught courses herself and for many, many years. We are blessed to receive her guidance and continue the journey. Shiv Darshan Yoga Vidyalaya is also recognized by the DSIR, Government of India, as Yoga Therapy and a Research Institute since 2002. Our Swamijis have been honored the title of Golden Swamiji in the Convention of Bihar School of Yoga in 2013. It's a real proud milestone that we've almost reached 31 years of this establishment. In this fast-paced world, people are losing touch with a balanced, traditional way of life and are finding comfort in, mindless entertainment, junk foods, overindulgence of senses. The ashram strives to instill and develop personal values, harmony, and mindful living through yogic practices like asanas, relaxation techniques, and meditation. So the ashram takes every opportunity to spread the cheer, goodness, and peace in the society. Here's a glimpse of a few courses that is offered in the ashram. Yoga Therapy Teacher Training, called TTC. This is focused on therapy. As you all know, yoga is a preventive science and also a therapeutic science. You can prevent it if you are a practitioner and avoid the diseases, or you can cure or at least manage the ailments through therapeutic advantages of yoga. So the yoga therapy teacher training is focused on training yoga teachers to understand the disease, diagnose it, and then also to provide treatment, yogic management. The first batch of yoga teacher training was conducted in 1997, is continuing till this day. So just to give you a high level view, we have TTC1, Train the Trainer Course 1, which contains high blood pressure, diabetes, asthma, spondylitis. These are the core ailments that the entire or in fact large amount of the population is suffering from. So we are focused on the psychosomatic diseases and to provide yogic treatment for that. TTC2 is the women-related health problems, which is menstrual disorders, thyroid, PCOD, prolapse, menopause. And TTC3 is specifically exclusive on the pregnancy period, which is the prenatal and the postnatal. From the time the woman becomes pregnant, the journey starts, and the yogic practices required for her to conceive, deliver the baby, healthy baby. And after delivery also, the practices that she would need to do for a healthy recovery and physical and mental health of the mother. We also have kids yoga. Swami Satyananji, Swami Shivananji loves children, They really love children. So, teaching, catch them young. That's the mantra. So teaching yoga to kids is another favorite aspect of Shiv Darshan Yoga Vidyalaya. There is always camps. There is, workshops. There's kids yoga is so much fun. And I used to be a kids yoga teacher also. So it's thoroughly the best of the course that I would enjoy is, being with the children. You become the children. I've enjoyed the course because the teachers who are older are they also become children, and the entire course is so much fun. As parents also, I think it's very important to catch the children young and introduce the yogic practices in their life for a well mentally, physically balanced, successive, productive, citizen. We also have other courses on the Chakra Awareness Program, Manipur Chakra, Mudras, also on Patanjali Yoga Sutra, which I think I just mentioned. For every yoga aspirant to understand yoga in its full form, everyone needs to understand and apply the Yoga Sutras, which is also a course, and many of you are, I think, part of that, I guess. Just some high-level highlights about the Shiv Darshan Yoga Vidyalaya and its courses are, all the courses are completely designed by Swamiji's, and the teachers are all under the tutelage, trained by Swamiji. It is under her guidance. And we also have doctors, which is like, medically certified doctors, part of this course journey as well, because we approach the ailment from a scientific angle and also from a yogic angle. So there is tradition and there is modern. So traditionally with yogic practices and with modern concepts and understanding the physiology, understanding the anatomy, etc., is also part of this course. So you will also have doctors, giving us the latest information and case studies from their experience, also part of this course, so that you have a whole total knowledge to handle the people who come to you. You will have a hands-on experience on the live projects because we believe that learning is one thing, understanding is another thing, but an application as a therapist, everyone will be empowered to apply this to your, I don't want to call patients, but the people who come to you for, for your guidance. So there are projects. You will be during this course, one goes through, to understand how to diagnose, what are the types of the ailments, and what stage it is, what is the lifestyle of the person, how to design the particular, course plan or a treatment for that person, and apply them and measure it and show it to prove it that, the effect of the practices. Because it's very important, as I mentioned to you, Swamijis are all, we have two advantages. One is these are all experimented, as in labs, repeatable experiments. Even your sleep is measured. We have had, various types of equipments measuring the effect of the practices, and it's experiential also. the books so that, written by all these Swamijis are experience nature. So both experimental and experiences combine in this course. So you will have a chance to apply it. You can pick your person that you want to having this particular ailment, and you can follow the journey and see the effect of the practices. And you will have a real-time experience to fine-tune the treatment as well. And the very, very important methodology that we follow is a written exam. Like always, we have written exams to evaluate your understanding. We also have a viva, which is to see how much of your understanding and how much you're able to communicate. Many times that we learn, we know, I know, but then I may not be able to do or tell other people. As yoga teachers, it's very important to communicate to people, make them understand, and ensure that the lineage or what has been taught to you is actually transmitted in the same form. So we actually evaluate as a teachers. You will be asked to teach, and then we will evaluate you and guide you and fine-tune you that after the end of the course, you are successful in handling a therapy in a therapy session. After this, you're always part of once the course is over, you'll be part of the alumni group, and always stay connected with the ashram and its activities. You will also have opportunities to be part of the teacher trainings conducted so that you get a real-time experience on teaching as well. We also have signature courses on Yoga Nidra and meditation. Yoga Nidra is it's a gift or a boon to mankind by Swami Satyananda Ji for the current stress and the mental illnesses that we are dealing with. And I hope you all have experienced that. Just a glimpse of the few activities and notable dignitaries who visited the ashram. As I mentioned, here we follow a Guru Sishya methodology, as always, in ashram style. As I mentioned, some dignitaries who have visited the ashram. We also have a ashram in Tiruvannamalai, and there is a trip shortly to the Tiruvannamalai ashram. Please, contact us if you would like to join us and enjoy the ashram in a serene environment. As I mentioned that from 2000 onwards, ashram has been conducting various research in the field of yoga because proving the effect of yogic practices through science, through repeatable experiments has been a focus of the ashram. We have had various studies on the effect of yogic practices on diabetes, asthma, on stress. And currently we also have these researches going on. Shankaprasthana on lifestyle diseases, Mahamrityunjaya mantra on stress, Nadi Shodhana Pranayama and Gayatri mantra on pulse and blood pressure. And also effect of Pavan Muktasana part 1 on high blood pressure patients. So you are welcome to be part of this research, contribute and learn and join the journey. With this, I would like to move on with our topic of today, which is the women's health. Can we get started? You can hear me? Can we continue?
Yes, ma'am.
Thank you. Okay, you see that women, right? For those of you who have joined here, either for yourself or for your family, for your daughter, your mother, your sisters. A healthy woman is a happy family. You all know the impact of when a woman in the family is affected with ill health. The entire family breaks down. Women is the centerpiece or the center point of a family, and her health is very, very important. According to the definition of World Health Organization, health is a state of complete physical, mental, and social well-being, also spiritual well-being now, but it's just not the absence of disease or infirmity. Women's health is actually very, very important because health is wealth, yes, but then women's health, because she's the center of the family, plus She deprioritizes herself many times. So sometimes it becomes very late in the stage by the time we identify the health. So we need to focus on the identification of or the warning signs of any diseases or conditions that she may have, and focus on the treatment for her physical and emotional well-being. So I welcome all of you who are here to pay more attention to the women in your lives. Could be your daughter. I'm sure every one of you are associated with women and need to understand women, the stages of life that you are associated with. You probably have a daughter which is like in the puberty stage, or a mother who's a little older and past the menopause stage, and of course a wife or a sister. So please understand that there are several stages in a woman's life, and each one comes with its own features, sometimes problems too. So in terms of years, as the smallest age is the infancy, when the child is born, and then she develops into a infant, into a small child, and then she reaches the most important milestone, which is the puberty or the adolescence. That's when the sexual maturation starts to happen, and slowly she moves into a reproductive age. And then while she's in the reproductive period, after childbirth, then there are a lot of changes that happen. She moves into the elderly or the menopausal age, and finally into the elderly stages. So at every stage, there are challenges, there are things that you need to be aware of, and then make sure that the body changes, the growth changes are all identified and held. And of course, in schools nowadays, a lot of education, and as parents and teachers, we have the responsibility to communicate and welcome each stage. If you are from I think in the South Indian culture, at least we have this separate function called the puberty function, Davani function, like that, where we welcome the milestone. That is actually a very auspicious milestone in a girl's life. So she will be having a lot of changes in her body. Her body is rapidly changing with psychological, physiological, psychological, physicals, the body shape changes, the growth happens, she gets her first period. And emotionally also, there are a lot of changes due to the change in the hormones. She will notice that, there are some, skin related changes, hair, etc. They need to understand, you need to educate them that, this is part of the growing, this is part of the development, and not, and also keep them aware that nothing to worry about. It's a healthy education is very important, so that they accept the changes that they have. And of course, in puberty, there are a lot of health-related problems may happen, like irregular menstruation, polycystic ovaries, psychological issues, etc. So need to keep them aware of this and identify them in the earlier stage before she gets into the reproductive age. This is a very, very important stage in the womanhood, where you are going through pregnancy and you're going to experience maternity. It's a joyous and a very fulfilling stage, but can also be very taxing, and potential health issues also is possible. So regular screening is important. Attention is important to the woman. And during the elderly years, when you pass the childhood bearing age, you move into the menopause stage, where the period cease to exist. Then because of that hormonal changes, again, there are a lot of things that the person will be going through. May have osteoporosis, may develop any kind of other cardiovascular issues. There's a lot of the hormonal changes that happens in that time. It's important to understand how am I feeling for every woman in this group, every woman to understand what are my symptoms, to identify, to understand their own body. Do I have cramps? Am I feeling bloated? Am I having fatigue? Not normal tiredness, but prolonged fatigue. What discomfort am I feeling is something introspection that everybody needs to have and identify. Not to worry, but then look for any warning signs, and then attend to them immediately. So in whichever stage you are, or in whichever stage you are, there are people that you know of. So it is our responsibility to identify and take good care of their health. for a happy living, for a healthy living, actually. So let's understand the menstrual cycle. It's very, very important. Men or women, everybody have to understand this, because a good knowledge on what is happening within your body will help to understand and handle the issues that one may come across during this period. You're still able to see my screen?
Green is blank.
Blank
Blank.
screen.
Let me share again. Now we're moving on to the, are you able to see my screen?
Yes.
Yeah.
Okay, let's understand the menstrual cycle. So we need to understand the female reproductive system. Only then we will understand what is really happening. Here is the picture of the, is the screen again visible? Just to double check.
No, ma'am. No, ma'am. Screen is not visible.
Now?
No.
No, ma'am.
Sharing my screen again, just having some. Try now. Is it okay?
Yeah.
Yes, ma'am. Yes, ma'am.
Thank you. Thank you for confirming. I would just like to confirm before I proceed. Okay. So here's the picture of the female reproductive system. You see the vagina. That's the canal that joins the cervix to the outside of the body. It's also known as the birth canal. The uterus, the womb, it's a hollow pear-shaped organ where the fetus develops. That's the ovaries. You can see them on the either side of the vagina. Are small oval-shaped glands that are located on either side of the uterus. They produce the eggs and the hormones. Fallopian tubes, these are narrow tubes that attach to the upper part of the uterus, and they actually act as pathways for the ova or the egg cells to travel from the ovaries to the uterus. The main function is to produce the female egg cells. It transports the eggs to the site of fertilization. And after fertilization, it provides a place for the baby to develop. If the fertilization does not happen, what happens? The system starts to menstruate, where we call it periods or menses. So puberty is very, very important. And then there are many problems that can happen during this menstrual cycle, which actually causes for further complications during pregnancy. This actually goes through a menstrual cycle, we call it, because it occurs every 28 days. And it contains few phases like the follicular phase, which is the development of the egg, the ovulatory phase, which is the release of the egg, and the luteal phase, which the hormone levels decrease if the eggs are not implanted. There are 4 main hormones that are there, and the hormonal imbalance can have the effect on the menstrual cycle. The follicular stimulating hormone, the luteinizing hormone, the estrogen, progesterone. So basically, the children actually, in fact, has become very, very less nowadays. But then usually it used to be like over 13 years or as late as 16 years. But the early it used to be like around 13 years. Now I hear that early puberty, which is even in a average year, is about 12. So it's the lifestyle. And sometimes it's genetics, but then it's usually the lifestyle, the food, the physical activities all determine the early onset of the menstrual cycle. The typical symptom would be bleeding, or sometimes you also have some symptoms like headache, mood swings, bloating, can have diarrhea, tiredness. So as I mentioned, right, so it's important to be aware of these and just not brush it away under the carpet and ignore any of this that may be in a prolonged nature. Some symptoms, Hariom. Some symptoms, need to be like cramps, can be very, very painful. It can affect their daily life. If it's a child going to school or, a woman going to work, it may really affect their daily life. If you remember in our culture, we had this where during periods time, we used to have the girl in a separate place. And in fact, in many cultures, I think I've seen in some South African cultures also, they are isolated into another place during this cycle because there is the body physiological changes are happening and it's time to rest. But today's world, everybody moves on with their responsibilities, school or college or work or anything with this physiological function happening. So it's extremely important to, prepare yourself and have a healthy, try to have a painless, I mean, not possible sometimes, but then, make it as painless as possible for the woman to go through this period with all the support and understanding. So basically, there are some disorders during this period which will disrupt the physical and the emotional well-being of the child or the lady. It could be like heavy bleeding, missed periods or unmanageable mood swings. All this can happen during the menstrual cycle and called together as menstrual disorders. So the types would be like premenstrual syndrome, which is PMS, or you can have amenorrhea, which is the absence of menstruation, not getting periods for a few months, and dysmenorrhea, or very painful periods, or heavy bleeding, or menorrhagia, and hypomenorrhea, which is like light or scanty periods. So there are various kinds of problems that a person can go through. So it's very important to monitor the cycle to ensure that you are aware of or identify any issues that is happening, any disruption in the menstrual cycle. So I'm moving on to understand. So a good understanding will be provided of the menstrual cycle, the types of problems, and how do we diagnose and to handle this condition. Moving on to the next condition called polycystic ovarian syndrome. Okay, as I mentioned, one of the issue that which disrupts the menstrual cycle is the hormonal imbalance. Yes, that is another cause for a disruption. So when the androgens, when there is a male hormone, right? Everybody has androgens, but then this hormone actually plays a very, very important role and is found to have an effect on the menstrual cycle. So basically, you see the picture where you see a normal ovary and you see a polycystic ovary. Small cyst. Cyst is nothing but a fluid-filled sac, which does not, is being released. So this actually forms a multitude. Poly means more, or the more than you can count. Cysts are those sacs and happens in the ovary. And it's a syndrome. Syndrome means it's just not one item. It's not one issue. It's a multiple, an umbrella of issues, which could be like, including from, hirsutism is one of the symptoms, right? So it could give rise to many problems. It happens as a group of issues. That's why it's called a syndrome. You would see that people who have polycystic ovarian syndrome have difficulty in conceiving. They will have a high case of, infertility. They may develop diabetes because of the insulin resistance that they develop. They also have, physically, they have so many changes. For example, they have a lot of acne. They will have, male pattern baldness. They will have hair in the faces like men. Women will have facial hair like men. And depression. People will have difficulty in consuming, will have, or be leading to depression. Plus, there are a lot of mood swings that happens that also will happen during this, people who have this. And today, infertility centers are growing like mushrooms. And a large part of the infertility issues come with polycystic ovarian syndrome issues. This could be identified earlier in their age, and you don't have to wait for the time when the girl is ready for the pregnancy or conceiving. So as I mentioned, it's important to monitor the menstrual cycle, understand if there are any issues, identify specific warning signs, and see if a missed period could be through PCOS. And there are ways to diagnose it. It's called Rotterdam criteria, and then it can help you to identify, is it only PCOS syndrome or a group of issues, or could be just PCOD, which is a polycystic ovarian disorder, which could be like an isolated case. I'm moving on to a menopause. Menopause is again another critical milestone in a woman's where you've had the puberty, and then childbirth also, or even without childbirth, menopause can happen. It's actually the final stage during the the end of the menstrual cycle, basically. Menopause. Meno means month, and pause means stop. Basically, there are no more monthly cycles. This is when the periods stop. As you see, the estrogen levels, right, the very important hormone for the menstrual cycle, decreases as we age. And you see the age a little below 50, right? Now I think there are, early menopause is becoming very common, but typically around 46 to 48, around that time, the women start to experience the menopause, and the periods cease to exist. This actually has stages, in the 4 stages actually, called premenopause, perimenopause, menopause, and postmenopause. So this is the first menstrual cycle to the first signs of menopause. This is actually the puberty to the end of childbearing age. Perimenopause is just before the actual menopause starts, and sometimes that can be very long period also. It won't be months, it can be years also, because a perimenopause is when the estrogen levels decline, they fluctuate, due to which you will have irregular menstrual cycle. Menopause is the actual cessation of the menstrual cycle, after which you don't get your monthly cycle. Postmenopause is, of course, the period after menopause. Beyond 12 months, if you have not got your periods, it means that the person has already reached the menopause stage, and anytime after that is called postmenopause, which happens usually after 50 plus, 52 plus. Again, because of the changes, there are so many things that can happen in the person's body. As we have seen our mothers, sometimes it is not noticed, we do not even know, but then we will see that the irritability is very high. There is anxiety, there is headaches, there is breast tenderness, there is abdominal cramps. So many things can happen, and mood swings we probably do not know, but then that is what the woman is going through during her menopause stage. Physical changes will also happen. For example, hair will become thinner, you will have hair loss, headaches, hot flashes, teeth and the gums will start receding. You may develop cardiovascular diseases, and the skin will become a little rougher, drier, and backaches, other dryness, skin dryness, vaginal dryness. Abdomen will lose the muscle tone. A lot of stress and urgent incontinence, that is the urinary incontinence, will happen, because I have noticed that people have come back on the menopause stage with with less control over the urine. It also can happen. Bone loss, bone mass could be there could be lessen of the bone mass can happen during this phase. So it's important to identify, be aware, and acknowledge. Suddenly you will see that they can have like a sweats, or called the hot flashes, that happen, which is like quite in the night. Sometimes you're wondering, it's very dramatic to wake up and then find out you are sweating even in an AC room, So you probably have heard somebody telling you all this. So this is all due to the changes that happens in the body, the palpitations, sudden, irregular, or fast heartbeats. These are all classic signs of menopause. So be aware of it, and try to address them, and try to handle this condition, acknowledge and handle this in a better way so that, it doesn't stress the person, or like, a fear. Fear is another thing that, you always now with, especially with Google and available and all the half information we have, we actually, try to become doctors ourselves and do, first worry, first get anxiety, and then, start doing things that, from the information that we have. So please understand and seek proper guidance. I'm moving on to another condition that, that also happens as the woman ages, is the uterus prolapse. This is very critical condition which really affects the, day-to-day life of the woman. So the pelvic floor, which is actually the floor which contains the critical organs of the woman, that pelvic organ is actually, it becomes prolapsed, which means that, it is actually lowered. The pelvic floor is actually a group of muscles. It's like a hammock, like a unjal. Sorry, I was talking in Tamil, but yes, like a unjal madri. It's a hammock actually, which actually holds all the pelvic organs like your bladder, uterus, vagina, small bowel, rectum, etc. Okay, so this actually, sometimes these pelvic organs, what happens, they start prolapsing, which is actually because of this heaviness, there is a lessened muscle tension, then it causes uterus prolapse, which actually comes out of the vagina. Again, urinary incontinence is definitely a problem that they will face during this time. During this time, the organs descend, they start drooping. Exactly, they start drooping, and then the bladder, the uterus, the vagina, the small bowel, rectum, all this are coming out of the vagina, which you can see in the picture. Because of this happens when the pelvic floor muscles and the ligaments stretch, they become weakened and they're not able to provide the support. And the uterus slips down and protrudes out of the vagina. This usually affects the post-menopausal woman. So it's a very difficult condition, and it happens in 4 stages. So the uterus is in the upper part of the vagina, then it slowly moves down to the opening, it starts bulging out, and then completely it's out of the vagina. The symptoms that the person will feel is like some heaviness or pulling in the pelvis. Tissues, you can see them, they are outside the vagina. Urinary problems, incontinence, and bowel movements also may be affected. So if you've had multiple pregnancies or a difficult labor, previously delivery of a large baby, being obese or overweight, lower estrogen levels, these are the possible causes of uterine prolapse, and a very complex condition. Prevention is definitely possible, so that we can prevent this condition through performing certain practices periodically before this happen. As I mentioned, yoga practices are preventive in nature. Varumun kaapom மறந்துட்டு நம்ம வந்தப்புறம் தவிப்போம்ன்ற நிலைமையில நம்ம இருக்கோம். So prevention before. So those of Yoga Sutra students will know heyam, dukham, anagatam. Avoid the problem before it comes, instead of firefighting after it comes. So we are very, very heyam, dukham, anagatam is something that we can apply to any ailment, but then especially to prolapse, to prevent this condition happening. So quickly, I want to cover about an important, or the master gland, and for the women, right? It is very, very important. Hormone, or the gland, thyroid. The reason I want to cover this is because to understand, it has a very important part in the metabolism. And it affects the entire thing, all that we talked about so far, right? Menstrual disorders. We talked about many, conditions during menstrual cycle. All this, right, happens. If the menstrual cycle is okay, polycystic ovaries doesn't really happen, correct? And then it will be easier with your menopause age also. And the entire, with the balanced thyroid hormone, the entire health, women's health will be in good condition. So this thyroid is very important to identify if the thyroid function is functioning properly through a few tests, and of course through some symptoms. Thyroid gland is the butterfly shaped gland that sits in the lower, the front of the neck. It's a ductus gland, and it's very, very critical to have this gland in good function, so that because it regulates many body functions, constantly releasing the amount of thyroid hormones in the bloodstream. It influences the metabolism, the growth and development, body temperature, brain development, cardiovascular system, bone metabolism, gallbladder and liver function, protein metabolism. There are so many functions that I can talk about, and I can't emphasize enough of good functioning or good function of a thyroid gland. So I want to bring focus and attention to this to ensure that thyroid, the practices are around better functioning of the thyroid gland. Basically, there are 3 hormones, which is T3, T4, and calcitonin, that actually is very important are made by this follicular epithelial cells. And it's very, very important to have this in balance. And we all know that iodine is the main building block for both the hormones. We will also understand the HPA axis, because the pituitary gland tells the thyroid gland whether to release more or less to the bloodstream. So that balance also is important for us to ensure that the menstrual cycle happens. The conditions that we deal with here are an overactive hyperthyroidism, அதாவது ஜாஸ்தி தைராய்டுன்ற ஒரு அந்த ஹார்மோன் வந்துட்டு ஜாஸ்தியா சுரந்தாலும் பிரச்சனை, கம்மியா சுரந்தாலும் பிரச்சனை, which means that it is overactive is also a problem and underactive is also a problem. Overactive is called hyperthyroidism and underactive is called hypothyroidism. So both are not good. So balance is all that is required. Thyroid actually disorders can cause puberty and menstruation to occur abnormally or even sometimes late. Abnormal levels will lead to very heavy menstrual cycles and sometimes absent of menstrual cycles as well. Not only during menstrual cycle, even during reproduction, may also affect the ovulation, the release of the egg for fertilization. It can even prevent ovulation. It will, there's an increased risk of cyst development because of the thyroid disorder. And after the baby birth, even milk production for the mother also may be a challenge. And that is during the reproduction. Once during the conception, even during the pregnancy, during the postpartum, there are problems that the woman will face because of the thyroid disorder. Miscarriage can happen, a preterm delivery can happen, a stillbirth can happen, and a postpartum hemorrhage can happen. So this is not to scare you, not to make you worry, but then to understand the emphasis of the the thyroid gland, so that we ensure that the function of the thyroid is at its optimum level, so that these issues are not, so no firefighting happens once the woman conceives. Instead, have it in balance. Even during menopause stage, right? There is the early onset can happen. We hear that people at 40 are arriving at the menopause stage. So that can, some symptoms like the overactive thyroid, which is the hyperthyroidism, will have like missed periods. Some people even mistake that as menopause. So, this actually is very, very important to understand how is the thyroid levels and is it truly menopause or not. And other issues like, an inability to sleep, people resort to sleeping pills. They may have depression or mood swings. All these can be during thyroid, because of thyroid. You would not know, you would just think that it's something else and you would not identify the root cause. So we believe in identifying the root cause, not doing, giving solutions for the problems or for the symptoms. So for those Tamil people who understand நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்பச் செயல், which actually means that identify the root cause, find out what is causing this issue, and then addressing that issue through solutions, so that it doesn't reoccur, and not just arresting the symptoms, just putting band-aid fixes, just fix the ones that are arresting the symptoms. That is not what we want to do. We want to understand. So if somebody is having an issue of issues in the menstrual cycle, thyroid could be the issue, but not knowing that will lead to so many complications from puberty to menopause. I hope this is really alarming, and again, my intention is to just to bring awareness and to make you aware that how important it is to check on it. So if there are weight changes, easily certain things like, some of them looking at a person, we can already tell, right? So as a yoga therapist, as yoga teachers, just physically looking at it, although if you don't know the diagnosis through nadis, etc., even just physical identification, their weight changes, right? The way that person looks fatigued, the physical movements, their hair, their skin, all can give you signs. So don't miss any warning sign that may identify it. So a diagnosis is very important for you to arrive at a good solution. So it's important that you identify the issues at the earliest stage as well. The earlier, the better. So look for hypothyroidism, which has dry hair, a puffy face, constipation, brittle nails, depression, memory loss. You would not know it's because of thyroid otherwise. And if it's a hyperthyroidism, look for hair loss, weight loss, softer nails, infertility, of course, sweating, irritability. So these are some signs that you have to look for in a hyperthyroidism. When you say you can also do tests, right? We also have lab tests. So if besides the physical features that indicate thyroid, please look for those tests that you can perform in order to ensure that this is identified and treated well. And from a yoga angle, you know that it is associated with Vishuddhi Chakra. This is the psychic center that performs, they say that it transforms poison to Amrit. So we will be doing practices that stimulate the front of the throat, okay, and that will actually, heal the issues, anything with the production of the thyroid gland. Okay, with this we come to this. இது வரைக்கும் நம்ம பேசினதெல்லாம் வந்துட்டு ஒரு விமனோட அந்த பூப்படையிறது, அதாவது இந்த வயதுக்கு வர்றது அப்படின்ற ஒரு ப்ரிப்பரேட்டரி ஸ்டேஜ், ஒரு பெண்மையோட முதல் கட்டம். அதுல இருந்து அவங்களுக்கு வந்துட்டு நிறைய பிரச்சனைகள் இருக்கும், உடல் அளவுல மனநல அளவுல மாற்றங்கள் இருக்கும். அந்த மாற்றங்களை எப்படி கண்டுபிடிக்கிறது, அதோட மூல காரணங்கள் என்ன கண்டுபிடிக்கிறது, அதுல என்னென்ன பிரச்சனைகள், ஒவ்வொரு ஸ்டேஜ்லயும் பிரச்சனை வரும். ஜஸ்ட் மிஸ்டு பீரியட்ஸா இருக்கலாம், இல்லைன்னா ஹெவி மென்ஸ்ட்ரல் ப்ளீடிங்கா இருக்கலாம். அப்புறம் பிகாஸ் ஆஃப் த மிஸ்டு பீரியட்ஸ் மற்ற கண்டிஷன்ஸ் வரும். அப்புறம் பியூபர்ட்டில இருந்து சைல்ட் பர்த் போது இந்த கண்டிஷன்ஸ் கண்டினியூ ஆச்சுன்னா வந்துட்டு பிரெக்னென்ட் ஆறதே கஷ்டமா இருக்கும். ஈவன் கன்சம்ப்ஷன், யூ ஹேவ் மென்ஸ்ட்ரல் சைக்கிள் இஷ்யூஸ், ஈவன் கன்சீவிங் இஸ் அ ப்ராப்ளம். அப்புறம் ஒரு தாய்மை அடையிறது கஷ்டமா இருக்கும். அந்த அப்படியே தாய்மை அடைஞ்சாலும் அந்த பிரசவ காலத்திலயும் அவங்களுக்கு நிறைய பிரச்சனைகள் வர வாய்ப்புகள் இருக்கு. அண்ட் தென் இட்ஸ் மெனோபாஸ், அதாவது அதோட முடிவு நிலைமை, அது வரும்போதும் நிறைய பிரச்சனைகள் வரும். ஏர்லியரா நடக்கும், அதனால ஹார்மோனல் சேஞ்சஸ் நடக்கும். So just to highlight that there are several phases, each has a specific marker for a change, the body and the physical and the emotional and the physiological changes that happen. உடல் அளவுல மனதளவுல நிறைய மாற்றங்கள் நடக்கும். அது ஒவ்வொன்றுத்தையும் வந்துட்டு ஏதாவது இம்பேலன்ஸ் இருந்தா அது கண்டிப்பா அதோட நடந்துச்சுன்னா அதை கண்டுபிடிக்கிறது ரொம்ப இம்பார்ட்டன்ட். நோய் நாடி நோய் முதல் நாடி சொன்ன மாதிரி அதோட ரூட் காஸை கண்டுபிடிக்கணும். ஃபைண்ட் த ரூட் காஸ் ஆஃப் த ப்ராப்ளம் அண்ட் அட்ரஸ் இட். ஸோ ஹவு டு வி டு இட்? ஓகே, இவ்வளோ நாடி ப்ராப்ளம் பத்தி பேசுறீங்க, கரெக்ட்? எல்லாமே ப்ராப்ளமா அப்படின்னு கேட்குறோம் இல்லையா? ஸோ யூ ப்ராப்ளி wondering, right? How, you talked about so many issues. Again, to highlight, my intention is not to scare you, to highlight or anything, but just to give you awareness and help us to help you as well, right? So to identify, so that as a parent, as a mother, as a sister, as a father, as a brother, everybody has a responsibility to help the women of the family to achieve good health and stay healthy, stay happy. So at Shivdarshan Yoga Vidyalaya, we have courses for you to learn from a physiological angle, from a medical angle, what the functions of the particular organ is, what are the stages it goes through, how to identify if there are any issues, and how to address it through yogic practices. So it has multiple, as you see, We cannot, if somebody asks me like what your asana to do for amenorrhea, so we just don't give you a band-aid fix. Just, okay, this asana, if you do, you see that many times there are many recommendations in many sites and many YouTube videos with just either asana or pranayama or just eat this food. If you eat this particular food or preparation, your cycle will be okay. I think we are, and which is actually, there are ancient practices. We have to give a solution in a holistic way. When I say holistic, in totality, considering so many things, we have to come up with a solution for any particular problem. So the yogic practices actually, objective is it provides good physical health. We all know that mental health is again is a effect of yoga. It gives a strength to the woman. It gives it lessens the stress. It gives flexibility. Digestion improves. Inflammation reduces. The person becomes a lower risk for cancer, which is the most scariest disease now, right? So that is something that you develop immunity to prevent any diseases. So we have to address the treatment from various angles: social, from spiritual, emotional, physical, environmental, intellectual, from all angles. If you were to provide a solution to the women's health, it'll be through, we have practices starting with lifestyle changes. Because if we do the asanas, pranayamas, whatever we teach you, and there are no lifestyle changes, the effect will not be there. So there is a commitment from the person who is providing the treatment and also the person who has come for treatment to make sure that there are small changes to their life, small daily routines, right? We all know about Dinacharya. We have a particular regime that we follow, but ensure towards healthier, follow the circadian rhythm of the body, use less plastic, less harmful substances which are exposes, gives us more risk for cancer, etc. Follow harmonious relationships. It's very, very important. When I say lifestyle changes, as we all know, Patanjali Yoga Sutra, the first one to start with is yama and niyama, right? Have the social good harmonious relationships, and also relationship with oneself. Personal hygiene is very, very important, which is also part of niyama. So the lifestyle changes is very important, because unless they commit to that, right? Unless there is a commitment for changes in small changes, then it is very, very difficult for other supportive practices to help them. So next one is be like diet, because in your class, in your session, you can teach them, you don't know what they go back and eat, and how harmful that can be, and it can bring the whole treatment or the whole therapeutic aspect to, it'll nullify the whole thing. So it's important to eat fresh, sattvic food, avoid fatty substances, preservative substances, also, preservatives, and which is high in sodium, etc. Keep it low fat, low carb, less oil, avoid bakery products. There are so many things that we will tell you. So it has to be a dietary change. It has to start, with the lifestyle change, which includes diet as well, but special focus on diet, because that is an important component. Unless you heal from inside, right? Heal from inside, then only then the effect will show on the outside. உணவு வந்து ரொம்ப ஒரு முக்கியமான காம்பனன்ட். நம்ம வந்துட்டு என்ன உள்ள போடுறோம், அந்த ட்ரீட்மெண்ட், அதாவது அந்த நோய்க்கு, அந்த ஒரு கண்டிஷனுக்கு வந்துட்டு அதோட ட்ரீட்மெண்ட் வந்துட்டு உள்ள இருந்து ஆரம்பிக்கணும். இட் கம்ஸ் ஃப்ரம் இன்சைட், ரைட்? ஸோ ஒரு ஸ்கின் ப்ராப்ளம் கூட நீங்க எவ்வளவு கிரீம்ஸ் போட்டா கூட வந்துட்டு will be like topical application, but then you eat and you ensure that the blood supply is there to that area, it will heal by itself. It's important. Diet is, I can't emphasize more on diet, so we have to take note of that. Yes, meditation. I'm covering the outer parts because those are supportive. If you have a good support of the system, only then the actual practices will have an effect. Meditation practices, mana amaidhikum, right? So many, we have several ajapa, we have so many yoga nidra, many meditation relaxation techniques. So we actually deal with the mind to heal the body, right? If your mind is not at rest, if the mind is going through so many things, so many issues, it will manifest as problems in the body. நமக்கு தெரியாது, நான் ஒன்னும் சாப்பிடலையே அப்படின்னு நம்ம சொல்லுவோம். ஏதோ செரிமானம் பிரச்சனை இருக்குன்னு சொல்லுவோம். ஆனா மனசு அமைதியா இல்லைன்னும் போது கட் ஃபீலிங் சொல்லுவோம் இல்லையா, மனசு வந்துட்டு எவ்வளவு வந்துட்டு வயத்துக்கு கனெக்ட் ஆயிருக்குன்றது we all know about vagus nerve எல்லாம் தெரியும் நமக்கு. So it's very important to deal with the mind, heal your mind also, and automatically your body will heal. So there will be practices practices on meditation for a healthy and a peaceful, calm mind. It's very important for you to continue the treatment to live a harmonious life as well. Spirituality, yes, as part of, you will have many opportunities to learn about oneself, to understand we have opportunities for seva, bhakti yoga. There are so many opportunities to be involved, to grow spiritually. And the main treatment includes through asanas, kriyas. Kriyas are cleansing techniques. நம்ம வந்துட்டு நம்மள டீடாக்சிஃபை பண்ணிட்டு ஒரு ட்ரீட்மெண்ட் ஆரம்பத்துக்கு முன்னாடி ஒரு எப்படி நம்ம வந்துட்டு நம்ம ஒரு பாத்திரத்துல ஏதாவது போடுறதுக்கு முன்னாடி அதை கழுவிட்டு தான் நம்ம ஆரம்பிப்போமோ அந்த மாதிரி இட்ஸ் இம்பார்ட்டன்ட் டு கிளீன், டு டீடாக்சிஃபை யுவர் பாடி அண்ட் ஸ்டார்ட் யுவர் therapy sessions. So that will happen through kriyas. We have several kriyas to cleanse the various parts of the body. Asanas practices, again, that will be designed based on that person. We have several practices that will strengthen the system. Asana practices around the reproductive area, your spine health, the entire joints. There are several practices for every part of the body that is required to have a good reproductive health. Pranayama, yes, we all know that pranayama is such an important. Prana is the vital force. Prana வந்து ஒரு பிராணம் இல்லாம இருக்க முடியாது இல்லையா? So நம்ம வந்துட்டு prana is the thing, right? How to save the energy, how to enhance the energy, this vital energy, right? Prana plus ayama, the extension of prana through various practices will be taught. And bandhas are locks, right? So those are also be taught. They also associated with pranayama. And mudras are hand gestures that will strengthen the system, will clear the blockages and the toxins. So as I mentioned, it's very easy to just prescribe or just to advise any one practice from either of this easily by anybody. But we believe in a total system, ensuring that identify the root cause and handle the root cause through a proper solution that is permanent in nature. So hence I would just invite you all to learn, to apply. It's very important to apply as well. It's not just, we just don't stop with learning. Therapy is all about application. So I take this opportunity to thank for this session, for all of you joining here, and for me to present the session. My sincere gratitude to Swamiji for this opportunity to spread the awareness of women's health. And sometimes the main reason is you don't know until the person breaks down. The woman in the family does not lie down just like that. They will take it to the point until such time when they cannot, until they break down. So we don't want that to happen. Either it could be yourself, it could be forget about others. Even the women in this group may be, sometimes suppressing their health issues and going on until it can go on. But change that. And this is something that I tell myself also to prioritize health. Yes, it's important. If you have traveled in an aeroplane, you always say, right, take care of yourself first and then attend to others. You put the oxygen mask, right? Put your oxygen mask first. Do an introspection, identify your health, stay cheerful, find out the solutions, and keep yogic management as part of your daily routine. And I'm sure all of us can lead a healthy, happy, and a harmonious life. இங்க சொல்லப்பட்டிருக்கிற வாழ்க்கை முறை சேஞ்சஸ், மாறுதல்கள், அப்புறம் உணவு பழக்க வழக்கங்கள் மாறுதல்கள், மெடிடேஷன் தியான முறைகள், அப்புறம் ஸ்பிரிச்சுவாலிட்டி, அதாவது கடவுள்னு நம்ம வந்துட்டு ரிலீஜியஸ் இத போகாம நம்ம நான் யார், நமக்கு வேண்டி நம்ம மனதுக்கு என்னென்ன மன பயிற்சிகள் பண்ண முடியுமோ அது தவிர ஆசனங்கள், கிரியாஸ், அதாவது உடல் பாகங்களை சுத்தம் பண்ணக்கூடிய நம்ம வந்து குளிக்கிறோம். ஆனா குளிக்கிறது வந்துட்டு வெளிய மேலோட போறது இல்லையா? ஆனா உள்ளுக்குள்ள உடல் உறுப்புக்குள்ள தேங்கி உள்ள அந்த நச்சுப் பொருட்கள் அதெல்லாம் வந்துட்டு தூய்மைப்படுத்துறதுக்கான நெறைய பிராக்டிசஸ் இருக்கு. பிராணாயாமா, பந்தாஸ், முத்ராஸ் இதன் மூலமாக ஒரு மொத்தமான ஒரு 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 சொல்யூஷன் மாதிரி. இது இப்போ யோகா எனக்கு இரெகுலர் பீரியட்ஸா இது சாப்பிடுங்க சரியா போயிடும். இல்ல இது வந்துட்டு இந்த பிராக்டிஸ் பண்ணுங்க சரியா போயிடும் அப்படின்னு குடுக்காம, ஒவ்வொருத்தருக்கு தேவை. உங்களுக்கு வந்துட்டு எப்படி வந்து ஒருத்தருக்கும் ஏதாவது இட்ஸ் நாட் லைக் a T-shirt, right? When I say XL, many people can fit into it. If I say double XL, some other people can fit into it. But this is the tailored solution that you will learn to create a tailored solution for each of the people approaching you, because one size does not fit all. ஒவ்வொருத்தரோட ஹெரிடிட்டி, அவங்களோட மரபணுக்கள் வேற மாதிரி இருக்கலாம், அவங்க வாழ்க்கை முறை வேற மாதிரி இருக்கலாம், அவங்க வேலை வேற மாதிரி இருக்கலாம், அவங்க குடும்ப சூழ்நிலை வேற மாதிரி இருக்கலாம், அவங்க உணவு, அவங்க கல்ச்சர், எவ்ரிதிங். There is so much of different. There is no woman who even from the same family are different, right? So you need to learn to tailor the treatment or the therapy sessions based on the total view of their understanding a person as a whole, and then only you can provide a therapy to them. So and sometimes some of them can be preventive. It doesn't always have to be addressing a problem. Some of them are preventive in nature. So you can introduce those sessions or practice sessions to people who are even healthy to avoid problems. As I said, yoga is a preventive and therapeutic science. It is a divine knowledge, and we are lucky to have that knowledge. And I welcome you all to indulge in this and have a journey to help to learn about oneself and to help others. So for more information, if I hope whatever we have shared is helpful to you. And if there are more information required, please feel free to reach out. We will be happy to help you. And we are keen on helping and spreading this awareness and helping women to achieve optimum health. So I've mentioned the address and the contact numbers here. We are happy to help in any way possible. I'm stopping my sharing. Hariom. I would like to hear from you. I hope it was helpful in some way. Yes? No?
Hello, ma'am. Good morning. My name is Bhanumati Balasubramanian. I got to know about this course from Baramudi sir. I'm doing the Patanjali
Very
Yoga
nice.
Sutra course. I've also
Very
done a basic teacher training course in yoga. I'm
Very
practicing yoga for the last 6 months only. I'm a
Wonderful.
chartered accountant by profession. And
Okay. I'm an
want to
IT
know-
professional by profession. So I'm an IT person by profession.
Okay, wonderful.
But so it's the
Uh,
profession and the passion, right? And the passion to learn this divine knowledge and the passion to share what the first thing is you transform yourself, right? With this knowledge. And then next is to transmit to others, right? So, so yes, you are in the right direction. I'm very glad you are following this journey. Yes.
Yeah.
This will definitely complement whatever you do. Whatever walks of life you are, whatever you do, this knowledge will complement whatever you do and enrich your, your total life.
Yeah. What I want to know is, I want to clarify that I'm not from medical background or, science background. And the other one is about the course itself. Are you going to actually, during the course, will the course teach us some asanas particular to the ailments? Will we be practically doing asanas?
Yes, yes.
So that
As
we
I
learn
mentioned to
them
you,
and we can transmit them.
Absolutely. It's all you have to learn. We will tell you the preparatory asanas, how to get there, so every asana will be introduced to you. If you look at this, the Bible, I would say, it's like the Gita for us is the APMB, Asana, Pranayama, Mudra, and Bandha, which is actually written by Swami Satyananda Saraswati. All asanas are mentioned to you in, when you introduce an asana, we will tell you the name of the asana, the Sanskrit name of the asana, why is it called so, how to prepare for that asana, what are the preparatory asanas, how to perform it. And during asana, there is a very important component called breath, right? The inhale, the exhale, the hold, and how long you can stay, and how many rounds minimum, and then how to come out of the asana. And if there are any counter asana that you need to do, that will be told. And you will be informed with the asanas if there are any restrictions. For example, not everybody can do everything. We will tell you who can do, who cannot do, right? All that will be shared with you, because it's very, very critical you have this information. It's because you cannot just give them something, and somebody who has a blood pressure, you won't tell them do Padahastasana because it's forward bending. That will affect them and can cause giddiness. So you will be equipped with all this knowledge to ensure that, you are able to provide that asana session comfortably with all the awareness.
Okay, the second question is, if suppose the course starts end of Jan or something, it's a 6 months course or 4 months course. And during the month of March, I'm traveling to India. We are coming to India.
Very nice.
And so maybe for, 2 weeks or something, I may not be able to physically attend, but I will go through the recordings. Is that okay?
Okay, so we don't want you to miss it. Okay, so we actually, to be honest, we are very, very strict about the attendance, because we don't want you to miss anything that the purpose of the attendance is to ensure that you don't miss anything. Because I just told you the kind of extensive information that's being shared. Yes,
Yeah.
recording is available, you can catch up, okay, but not more than 2 weeks, because then you will lose touch, because there are various subjects, and you will have to prepare. And it's not, the exam is like, there is a final exam, but at the end of every subject, you will be, evaluated. For example, have you understand menstrual cycle first? Only then we go on to, PCOS. We will not touch the whole thing. I want you to, we will make sure that, you understand that particular subject, you evaluate yourself. We have a Viva, which means that we will ask you questions, how you present, and then we move on to the next one. So the course schedule is very, very nicely prepared for the duration of the course, with specific number of days for each subject, and with evaluation in between before we start the next subject, and a final evaluation and sessions as well. And your performance could be both through your practice as well. We will watch your practices, correct you where you could go wrong. And if you're not able to do certain things, we will tell you how else can you do it. Sometimes if you're not able to do not everybody can do everything, right? We will make sure, we ensure that, what is the ultimate posture that you need to reach, right? If you how to achieve that will also be guided. Okay.
Okay, so I'm definitely interested in
Where are you
joining, but
from?
like I
Which
said,
part of where are you?
pardon me.
Where are you from? Where are you from?
Right now, in Doha, Qatar.
Qatar. Okay, fine.
Yeah.
Okay, the time difference
So
is something that you'll have to manage.
no, that is okay. That's time difference is comfortable. Sundays, I'll have
Yes.
to join. But like I said, during the month of March, there will be a disruption in the attendance. I will manage that. I mean, I
Okay,
will
give
see the
us advance
recording.
notice.
You can test.
Yeah.
You know.
Thank you for this advance notice.
Yeah.
What we could do is that we could do a catch up or something. If you have any specific queries after the viewing the recording, I'm sure we will be able to help you with that.
Thank you. Thank you so
Thank
much. Thank you so much. The session was very good. I do
Thank you.
intend to join.
For those of you who want to ping your numbers, we can contact you, or I can put the number again here for you to take note and reach out to us. The next class is starting. Let me confirm the date. So yeah, take your time, and you can write to us. You can through email or through phone. For phone is better, so that we can clarify your doubts. So I'm putting this message here. Please contact. You can refer this webinar that you attended. You can ask your queries and take note of this number and reach out. We'll be happy to help you.
Okay, excellent. Okay. So the
Anybody
course
else?
starts when?
I'll just confirm to you. I got the date.
Next Sunday, ma'am, 21st.
Okay, sorry,
Excellent.
sir. Yes, 21st.
Okay. Thank you, sir.
Yes. You're just in time. And Balamali sir, she's traveling. And if you're traveling, please remember to visit us. You're welcome to the ashram. Please do come down. If you can connect in the ashram physically with Swamiji, see our ashram, etc. But then yes, catch up with when you miss it. Okay. Looking forward to connect.
Right.
Anybody
Likewise.
else?
Thank you so much.
You have a good day ahead. Anybody else? Anything?
Vanakkam Kavita ma, I'm speaking to you from Mumbai.
I wanted
Okay.
to know when you all have mentioned about all these gynecological issues that women are having, young women also having,
Yes.
then surely at the ashram or even in the past courses, there must be some case studies where it got resolved.
Yes, we have that. We can share that with you as well, right? So we
One
have
or two, if
people.
you can mention it, how and what it was, which way it was resolved, what was the core issue, and how, which was the sequence of asanas, or what was the one thing that maybe really made a turnaround for this person, for the lady.
Okay, actually, I have several cases. In fact, my own students and my students, because we teach teachers, right? So the infertility issue, I think I've had the most joyous moment for me is when say that, I have conceived, or like I had the PCOD issue resolved, because that is something that, that's very close to my heart. So I've had cases where, like, with long time of, not having the child, the depression and the anxiety the woman has gone through, and then especially the facial hairs, which actually, for women, it is very difficult to manage. So I've known many people who suffered with PCOD in specific, and then through these practices, right? Again, I told you I don't want to mention this. Of course, everybody knows like Surya Namaskar, which balances the hormones, right? It is Surya Namaskar is one holistic practice, which is like fully physical, even the awareness of chakras. So it is one sadhana. It is as mantras. So I would just, since you asked me for one, I would tell one, but there are many more. Has made remarkable differences in the lives of the women and has changed their life. Imagine for a woman who is not conceived for 5 years or something, and then had the PCOD issue resolved, and then having a child, healthy delivery is something that, has brought so much of joy to me. I can't explain how happy I feel when I hear this. And even people who are relieving from mental and physical issues, right? Mental is definitely the mood changes has happened, but முதல்ல மாதிரி அவ்வளோ heavy menstruation இல்ல, or அந்த பீரியட் போது என்னால லீவ் தான் போடுவேன், என்னால வந்துட்டு ஆஃபீஸ்க்கு ஸ்கூலுக்குலாம் போக முடியாதுன்னு சொல்றவங்க இப்போ வந்துட்டு it's getting better. Some of them, there is a definite relief in the pain சொல்லும்போது, you really feel good, because we actually we strengthen the reproductive organs, the entire system, right? The anything, all the asanas around the abdomen area strengthens, flushes blood into it, it repairs the organs, so that organs does their part. Any blockages are removed, toxins are removed, blood flow happens, so the actual function of the organs happen, and then it becomes normal. It's not magical. It takes effort, it takes practice, it takes guidance. So abhyasa vairagyabhyam tannirodha, to receive that, to reach that state, to reach and remain in that state, a constant practice, acceptance of this problem, and identification of the root cause of the problem, and application of the practices is very important for a sustained well-being.
But what about this diet? How are you all suggesting them to change the diet? There's somebody who's an Ayurveda Acharya or a Vaidya who will be guiding them.
Yes, we do have prescription. I said this whole thing is designed by Swamiji. Yes,
Right.
so you will have for each of the ailments, there will be food changes. As I mentioned, diet is a very important component, and we'll give you those that are for every ailment, or as a whole also, like total well-being, how to approach diet. The relationship with food is very important, because food is not just that you consume, and eating is not a part of your routine, right? How food nourishes you, what are the types of food, what are the effects of food on your body, right? The gunas of the food and the effect it has on your body, and some of them are nourishing, some of them are healing, right? That knowledge will help you to choose your food. It's not like eat this, eat that, right? So when I say low carb, right, when I say low fat, it's one term, but then you know that, no, you will choose that, okay, you would rather choose fried food than, you will not choose fried food, but rather you will choose, a steamed or boiled food, or even baked ones, for example. So we will give you that knowledge to make your choices, because this has to be something that you have to learn and apply. It cannot be like, I can't say like, this is your diet from morning 8 a.m. you will eat this till the night 7 p.m. It's not that. It's the food, the timing is important. What you eat is important. How much you eat is important, and what you eat with what. In Ayurveda, as you mentioned, right, you don't eat and combine certain things. So eat the right thing at the right time, and then at the right quantity with the right attitude. It makes a difference. For those of you from Tamil, நமக்கு வந்துட்டு மருந்து ஒரு அதிகாரமே இருக்கு திருக்குறள்ல. சோ மருந்தென வேண்டாமாம் யாக்கைக்கு, யாராவது அன்மியூட் பண்ணி சொல்லுங்க. அருந்தியது அற்றியது போற்றியோனேன். அதாவது மருந்தே ஒருத்தருக்கு வேண்டாமா, யாருக்கு? என்ன சாப்பிடணும்னு தெரிஞ்சு அதை சாப்பிட்டு, அது சாப்பிட்டது ஏற்கனவே சரிச்சாச்சு. ஏற்கனவே அது வந்துட்டு அது அந்த அதோட வேலை முடிஞ்சாச்சு. அந்த உடல்ல அந்த அதோட இருக்க நரிஷ்மெண்ட் எல்லாம் எடுத்தாச்சுன்னு தெரிஞ்சு அடுத்த வேலை சாப்பிடுறாங்க பாத்தீங்களா, அவங்களுக்கு தான் மருந்தே வேண்டாமான்னு சொல்லியிருக்கு. சோ உணவே மருந்துன்றதுதான் நம்மளோட கல்ச்சர். Food is thy medicine. So if you today what happens? People are taking medicine like their food, right? இவ்வளவு கலரா டேப்லெட், சிரப்பு, அப்புறம் சாஷேல, அப்புறம் இன்ஜெக்ஷன் வேற. சோ மருந்து வந்து today has become like food, but food is their medicine. You have to heal your body through taking food internally, and it will manifest as nourishment for the body. So not to worry about that.
But specific to menstrual cycle and preconception and all those things, some dietary specifications are given or what?
To
As you're
strengthen
saying,
again, it's
avoid,
again
yeah.
strengthening the reproductive organs. Yes, and most important is digestion, because digestion is very important, right? And the digestion increase பண்றதுக்கு, to increase your Jatara Agni, right? And then to remove constipation, that will also, just not only periods, right? The entire, for example, somebody who has a obesity as an issue, with addressing food and digestion issues, constipation issues, okay, addressing the food will reduce in the obesity. Reduction in obesity will actually result in your menstrual cycle being addressed. Reduction will in obesity will increase your chance of consumption. So it is like, it is a totality. Again, eat this, this will happen. It's not that, like, what needs to be done to resolve the root cause will be addressed from various angles.
Atma Namaste, ma'am.
Yes, namaste.
I'm a student pursuing my engineering from Andhra Pradesh, ma'am. I'm 20 years
Nice.
old. Ma'am, I'm suffering from PCOD from last 4 months.
Okay, last 4 months.
Yes, ma'am. I regularly practice yoga in my college.
Very nice.
Can you please give me some inputs what to eat so that I can cure naturally? Or
So just food alone, as I mentioned, right? This is like a food alone will not fix it, right?
Okay,
Asanas alone will not fix it, because other things are important. As I mentioned to you, let me apologize. I'm extremely sorry. I would not be able to provide any one particular solution. I don't like to put band-aids for wherever it is hurt. We need the entire total recovery done for the entire problem. So I'm very happy that you've been diagnosed. Did you do a scan? Was there a medical doctor who certified you having cysts in your ovaries?
Yes, ma'am. I have scanning.
Okay, so the diagnosis is done. The diagnosis is done. So I'm happy to. You can hear me now?
Yes, ma'am. I can hear you. Yes.
Hello.
Yes, ma'am.
Okay. So I was just saying that I'm glad that you've identified it and you're already working towards that, right? It's very important to have the diagnosis done and taking actions towards it. So along with the asana practice, yes, food, try to eat nourishing foods that will actually have an effect on your weight, actually, which will actually enhance the reduction of weight, will enhance your practices as well, right? So as I mentioned, we have for the body, we have physical practices, asanas, and kriyas. Kriyas are cleansing
practices. I do kriyas.
That will also, yes, you do kriyas also, very good. So that will help
Jalaniti,
you to,
Sudraniti,
when it is clean, when it is detoxified, your absorption will be.
Yes, ma'am. I do Vastradauti, Jalaniti, Sudraniti. Those kriyas I practice.
Wonderful. Okay. We also have other practices for the entire alimentary canal.
Okay.
So what you eat today, right? It actually does not actually go out, right? When your bowel movements happen,
yes,
there is still some part of it stays in your, large intestine, in the rectum. We do practices to cleanse it. For example, if you drink water, water will come out. That kind of a cleansing, we have practices that will enhance the, the absorption capacity, the assimilation capacity, and the longevity of the entire. So how do you think the Siddhas and Rishis live for hundreds and thousands of years is using these practices only?
Okay, ma'am.
I'm looking forward. If you can, please do inquire on this, and it is only on Sundays. So while you do your education, you can actually get this education also and empower yourself with the knowledge to handle your condition. And given an opportunity, you should be able to share this with your other friends and family who are going through this, right?
Yes,
only when because only if it hurts, if the pain is experienced, then you really know what it is like. You probably know firsthand. I don't have to tell you, like, it will be like this because you know it firsthand. You can learn it, you can transform yourself, and then get ready to transmit to others. We
Yes, ma'am.
welcome you to this.
Thank
series.
you, ma'am.
Thank you. So I'm looking forward. Do you want us to contact you, or do you have the contact information to connect?
Ma'am, I'll contact you.
You have the numbers?
Yes, ma'am.
I just pasted in the chat if you want.
Yes, ma'am.
Thank you so much. Anybody, any
Ma'am,
queries? Sorry, it is longer because, yes.
yes, ma'am. Good morning, ma'am. Wonderful session, ma'am. Thank you for that.
Thank you.
One thing I want to know, is there any direct full-fledged yoga certificate course, like a 1-year course like that? I'm in Chennai only. I would like to do one direct
Okay.
full-fledged course on yoga therapy, ma'am. I done my MSc yoga.
Oh, very nice. Can you give me your contact number? Can you type in your contact number? Maybe we'll take note. We'll reach out to you. There are 3 months, several courses which can taken to a 1 year also. So we can plan that schedule for you so that you get the required certification. Can you, maybe Maramurali sir, you can take note of a number so that we can reach out and provide the information. Can you type it in the chat, ma'am? So we will.
Yes, ma'am.
Or you can just
Yes,
contact
ma'am.
this number.
Yeah,
Also,
ma'am.
you can do that.
I have the number. I have the number, ma'am. I will contact. Direct
So
class,
reach
I'm
out and
more
we will help you with
interested.
that. I mean,
Yes, yes, ma'am.
yeah, we will help you with the information that is required. Not to worry about that. Yes, I
Yes,
mean, certification is very important so that right, you are certified a therapist. Comes with learning, a lot of learning experiences that you will get during the course. Plus, you also get the experience from the other people who are training you, right? So all the case studies will help you to prepare. And and thank you for keeping that time. 1 year is a good time for you to invest on this time.
Yes,
And learn the therapy aspects.
yes, ma'am. Thank you so much.
So Palamuri sir, maybe can you take down our number? Madam Bhanumati madam would like to connect. I'm not sure if he's available to speak. உங்க நம்பர் என்ன சொல்லுங்க. நான் வந்துட்டு நீங்க சென்னையிலே இருக்கிறதுனால மேபி நீங்க போய் ஆஷன் கூட போய் பார்க்கலாம், பேசலாம், சுவாமிஜி மீட் பண்ணுங்க. உங்களுக்கு thorough guidance. நீங்க உங்க எஃபர்ட் போடுறேன்னு நீங்க சொன்னதுக்கு ரொம்ப சந்தோஷம். Because people want to quick workshop. One workshop you want to attend and you want to know everything, right? அந்த மாதிரி இல்லாம நீங்க வந்துட்டு எஃபர்ட் போடுறேன்னு சொல்றது ரொம்ப சந்தோஷமா கேக்குது. Anybody else, any questions? Again, sorry, don't want to take your time too much. I think I was very happy to share this information, and the interest and the attitude towards people to be part to acquire this knowledge is really inspiring.
Thank you, Kavita, for a wonderful session. Thank you so much for the wonderful session. Very informative. And thank you.
Thank you, Vijay. Thank you so much. Yes, if you're all in the group, please stay connected. You will have multiple webinars. We want to give you the awareness. We want to, enrich you. That's why we call it TTC, right? We train the trainers. We want people to be trained to do this in your own way, right? In your own area, in your own group of people. So all that we could do is we can enrich you with the information. So, we give you, we teach you fishing for you to continue to fish and help people that needs it.
Yes, ma'am. So apart from this course, what you can design a comprehensive course with including the other parts like the blood pressure and the other part. Apart from that, you can give us a comprehensive course for a year, if I'm able to commit a year to this.
Yeah, that's exactly, I think she was asking, right? So yes, we can decide.
Yeah.
That would include, usually people come here to us at yoga teachers who know something, right? Who knows the yoga philosophy, who knows, the anatomy and physiology. Some people who come with certain qualifications.
I know that. I've done the teacher training course from Aviyog.
Okay.
Kavita, I think we can discuss with Swamiji on this and get back, we can put together some of the courses together as a package. And then we can start promoting like that. Yes, we can do that definitely.
Yeah. So a combined, a whole one, not piecemeal.
Yeah.
Like women's problems or, high blood pressure. So something combined, I would definitely be more interested in, because for me, it will give me, the bird's eye view, the bigger picture as well for the student who is going to come. So that was an excellent question by whoever asked that, the lady who asked before me.
This actually,
So hopefully it will be online, and definitely I'm able to invest a year in it. Weekends, I will definitely invest in this if it is available. And so I'm in the Patanjali Yoga Sutra class right now with Bala Murali sir. So if you can post in that group this information before the 21st of this month, before this course starts, that would be very helpful. So it will give us, it will give us a better ability to decide based on information available. We can make an
I will get Bala Murali sir to communicate with you. Yeah, sure. Thank you for your interest. Thank you for asking, and this is something that we could think about. Okay, to give a total package also.
Yeah.
I will talk to Swamiji about it, and I will communicate this so that we can take steps towards that.
Yeah. So before the 21st, if possible, because if that is not available, then I would like to go ahead with this piecemeal course.
It's quite, actually, it's a week is quite short time to decide and plan the schedule and get the people, and we need to invest the time to plan and prepare and give you the entire package, right? So I doubt it, but then as soon as things are available, I will let you know. Since you are in touch with Bala Murali sir, he will connect with you also.
So then I will hold back on joining this course. I will.
I'll get them to communicate you. I mean, as I told you, it's a very short time for us to come up with that comprehensive course for now. Okay, but anyway, I will communicate your interest and see how we can address your interest.
All right. Thank you.
I'm taking note and I'm communicating right away your interest.
Thank you. Thanks.
So may you all succeed. May you all continue your journey. May you all, take this divine knowledge to people and help them.
Hello,
help people. Yes, ma'am.
Excuse me, ma'am. Ma'am, Vadam, Pitam, Kabam, அதை பத்தி கொஞ்சம் எக்ஸ்பிளைன் பண்ண முடியுமா?
Okay, that is actually நான் சொன்ன மாதிரி ஒவ்வொருத்தரோட உடம்பு வேற மாதிரி. ஒருத்தர் 2 பேரோட உடம்பு, ஒரு சிஸ்டர்ஸ் இருந்தா கூட அவங்க உடம்பு ஒரு மாதிரி இருக்காது. சோ அவங்க உடம்பு காம்போசிஷனுக்கு ஏத்த மாதிரியும் இருக்கும். இப்ப நீங்க மெனோபாஸே பாத்தீங்கன்னா சிம்டம்ஸ் வந்துட்டு ஒரு வாத உடம்புக்கு வேற மாதிரி இருக்கும். ஓகே, ஒரு கப உடம்புக்கு வேற மாதிரி இருக்கும். அதனால வந்துட்டு ஒவ்வொரு உடம்புக்கும் வந்து எந்த மாதிரி இருக்கும் அப்படின்றதும் உங்களுக்கு வந்துட்டு நாங்க சொல்லுவோம். அப்பதான் வந்து உங்களுக்கு வந்துட்டு அது புரியும். ஏன்னா அந்த ட்ரைனஸ் வந்துட்டு சில பேருக்கு இருக்கும், சில பேருக்கு வந்துட்டு வேற மாதிரி ஒரு வெட்னஸ் இருக்கும். சோ இந்த குணங்கள், அதாவது இந்த தோஷங்கள் சொல்றோம் இல்லையா, இந்த திரிதோஷா, இந்த திரிதோஷாவோட இம்பேலன்ஸ், ஆயுர்வேதில என்ன சொல்லுது, இம்பேலன்ஸ் ஆஃப் திஸ் தோஷாஸ் தான் இந்த மெயின் ப்ராப்ளம் ஃபார் த இம்பேலன்ஸ் ஆஃப் த ஹார்மோன்ஸ் அண்ட் த ஹெல்த் எல்லாமே. சோ அதை பத்தியான நிறைய விஷயங்கள் சொல்லித்தரப்படும். ஒவ்வொரு நம்ம பேசின ஒவ்வொரு பிரச்சனைக்கும் ஒவ்வொரு விதமான உடம்புக்காரர்களுக்கும் வேற வேற மாதிரியான அது வெளிப்படும். அதுக்கு மருந்துகளும் வேற மாதிரி இருக்கும், அதோட தீர்வும் வேற மாதிரி இருக்கும். சோ நாங்க பிசிக்கல் ஆசனாஸும் வந்துட்டு we will explain to you that யாரு எது பண்ணணும், எது பண்ணக்கூடாது. ஃபார் எக்ஸாம்பிள், ஒருத்தவங்களுக்கு ரொம்ப பிராணாயாமல இப்ப சீத்தலி இருக்கு அப்படின்னாக்கா, இப்ப குளிரா இருக்கு, அவங்களுக்கு ஏற்கனவே வந்துட்டு ரொம்ப கபம் இருக்கு, ரொம்ப சீதளமான இது பண்ணக்கூடாது, சாப்பிட மாட்டாங்க அப்படின்னாக்கா, அவங்களுக்கு உணவு முறையும் வந்துட்டு பார்க்கணும். தவிர இந்த ப்ராக்டிசஸும் வந்துட்டு அதிகப்படுத்தக்கூடாது. அதுக்கு வந்துட்டு அதை வந்து மேனேஜ் பண்றதோ இல்ல வந்துட்டு அதுக்கு வந்துட்டு அந்த ஒரு தீர்வா தான் வந்துட்டு நம்ம வந்து கொடுக்க முடியும். So the Tridosha will be taken into considerations while you design your to identify the symptoms and provide solutions.
Thank you, ma'am.
Thank you.
Namaste, ma'am. This is Reshma.
Hello, Reshma.
Ma'am. It was a very good session, ma'am. And I'm talking from Mysore.
Sure.
So actually, I've completed my PG diploma in yoga, ma'am.
Very nice.
And my parents live in Pondicherry. எனக்கு ரொம்பவே தெரப்பி கோர்சஸ்ல ரொம்பவே இன்ட்ரெஸ்ட் இருக்கு. ஸோ எனக்கு 1 year கோர்ஸ் மாதிரி அவங்க சொன்ன மாதிரி எனக்கு 1 year கோர்ஸ் பண்றதுக்கு இது இருக்கு, இன்ட்ரெஸ்ட் இருக்கு. ஸோ நான் ஆக்சுவலி பாலமுரளி சார் கிட்ட இந்த அப்ரோச் பண்ணியிருந்தேன். ஸோ இப்பதான் எனக்கு இந்த ஷார்ட் கோர்சஸ் எனக்கு தெரிய வந்தது. But as they said, I too need a very 1 year கோர்ஸ் மாதிரி ஏதாவது நீங்க அரேஞ்ச் பண்ண முடிஞ்சதுன்னா.
Okay, so I'm increasing the count for this request. I will
Yes,
inform
ma'am.
as Vijay ma'am mentioned, right? We will have to get back to Swamiji and design a course, right? It will start from various aspects that we need to cover for an yoga aspirant. இதெல்லாம் தெரிஞ்சிருக்கணும் அப்படின்னு நம்ம கோர்ஸ் நீங்க கேட்கறது வந்து எனக்கு புரியுது. இந்த கோர்சஸ் வந்துட்டு ப்ராப்ளம் இருக்கு, ஏற்கனவே யோகா படிச்சவங்களுக்கும் அது யூஸ் ஆகும். ஈவன் as parents படிச்சா கூட வந்துட்டு நம்ம anatomy physiology எல்லாம் சொல்லி தர போறோம். என்ன பண்ணணும், என்ன பண்ணக்கூடாது, என்ன சாப்பிடணும், என்ன சாப்பிடக்கூடாது, everything will be things. But then it is train the trainer courses. ஓகேவா? உங்களுக்கு கொஞ்சம் ஏற்கனவே பிஜி டிப்ளமா பண்றதுனால you are qualified to do this. Okay, but in parallel உங்களுக்கு வந்து இந்த இன்ட்ரெஸ்ட் இருக்கிறதுனால மத்த aspects of yoga, maybe yoga philosophy, further anatomy and physiology, அந்த மாதிரி general things இருக்கிற மாதிரி ஒரு கோர்ஸ் நீங்க கேட்டா கூட, யோகா ஹிஸ்டரி அந்த மாதிரி நிறைய இருக்கு, நிறைய ஆஸ்பெக்ட்ஸ் இருக்கு. நீங்க டிப்ளமாலே படிச்சிருப்பீங்க, அதுவும் இன்க்ளூட் பண்ணா வந்துட்டு இட் பிகம் a complete course இல்லையா? அது I taken the request. I will inform Swamiji.
Yes, ma'am. Yeah, because this is a very reputed institution and a very like in the sun. So I wanted like 1 year course certificate அந்த மாதிரி கிடைச்சா ரொம்பவே நமக்கு யூஸ்ஃபுல்லா இருக்கும். Because I'm searching many ways, ma'am. சிதம்பரம்ல, அண்ணாமலையில அந்த மாதிரி எல்லாம் ரொம்பவே நான் ட்ரை பண்ணிட்டேன். But I was not so much satisfied. So I was very grateful that I got your contact and I'm in this group. Yes, ma'am.
It all happened for a reason, okay? It's all part of the divine plan. Every single person who joined and who could not join is also part of the divine plan. So keep that in your mind and then continue your efforts. Keep you said that you're in the Yoga Sudra class at சொல்லிட்டீங்க இல்லையா? So உங்க எஃபர்ட்க்கு ஏத்த மாதிரி definitely they will be rewarded. மிருது மத்திய அதிமாத்திரத்வா ததோபி விசேஷः. So மிருது எஃபர்ட் போடுங்க, மத்திய எஃபர்ட் போடுங்க, அதிமாத்திர எஃபர்ட்டும் போடுங்க. கண்டினியூ பண்ணிட்டே இருங்க, அபியாசம் பண்ணிட்டே இருங்க. அபியாச வைராகியாபியாம் நிரோதः. So எல்லாமே சொல்யூஷன்ஸ் வரும். Thank you so much. நமஸ்தே மேம். வேற யாருக்காவது ஏதாவது क्वेश्चंस இருக்கா?
மேம் ஹரி ஓம் மேம். நான் இங்க இப்பதான் மேம் முடிச்சிருக்கேன். அஞ்சனா, எனக்குமே இந்த மாதிரி ஒரு கோர்ஸ் தான் மேம். இப்ப அவங்க எல்லாம் ரெக்வஸ்ட் வச்ச மாதிரி அதே மாதிரி எனக்கு ஒரு தெரப்பி கோர்ஸ் தான் மேம் நானும் தேடிட்டு இருக்கேன். ஒரு ஃபுல் ஃபிளஜா வந்து தனி இல்லாம ஒரு ஃபுல்லா ஒரு கோர்ஸ் இருந்தா நல்லா இருக்கும் அப்படின்னு சொல்லிட்டு.
Okay, I got it. I heard you. I've communicated already.
Sure, ma'am. Thank you, ma'am.
நீங்க வந்து தெரப்பி full-fledged therapy course for covering many ailments, ஒரு complete course மாதிரி கேக்குறீங்க இல்லையா? புரியுது.
Thank you, ma'am.
சரிங்க. Very good. Happy have a good kids yoga. ரொம்ப important. ரொம்ப ஜாலியா இருக்கும். நல்லா போதா?
Yes, ma'am. Yes, ma'am. இப்போ validatory functionக்காக waiting, ma'am.
ஓ, வரீங்களா? திருவண்ணாமலை வரீங்களா?
Yes, ma'am.
Very nice.
Okay.
பார்க்கலாம்.
Thank you.
You're all welcome to திருவண்ணாமலை Ashram. So we are having a validatory function for the previously completed aspirants. You're welcome to join.
Sure, ma'am. Thank you, ma'am.
Thank you. I mean, so course certification is one. அதுல வந்து the application is very important. அதுதான் is very key. நம்ம எவ்வளோ ஒர்க்ஷிப்ஸ், எவ்வளோ புக்ஸ் வச்சுக்கலாம், எவ்வளோ பிடிஎஃப் வச்சுக்கலாம், எவ்வளவோ சர்டிஃபிகேட்ஸ் வாங்கி ஃப்ரேம் போட்டு மாட்டிக்கலாம். பட் அதை எப்படி அப்ளை பண்றதுன்றதுதான் இது ரொம்ப இம்பார்ட்டன்ட். அதை உங்களுக்கு கற்றுக் கொடுத்து அதை வந்து உங்களை வந்துட்டு ஒரு தெரபிஸ்ட் ஆக்குறது தான் வந்துட்டு அப்ஜெக்டிவ். ஸோ நீங்க உங்களுக்கு தெரிஞ்ச உங்க சர்க்கிள்குள்ள நீங்க ஒரு டீச்சரை உருவாக்குறது தான் டீச்சர்ஸ். பிகாஸ் வி வாண்ட் டு ஸ்ப்ரெட். சுவாமிஜியோட வந்துட்டு கீ அப்ஜெக்டிவ் பாத்தீங்கன்னா ஸ்ப்ரெட் யோகா டோர் டு டோர், ஷோர் டு ஷோர். அந்த ஒரு தான் மோட்டோ. ஸோ அதை வந்து தான் இப்போ வந்து டோர் டு டோர்னா இப்போ சென்னையில நிறைய பேருக்கு தெரிஞ்சிருக்கு, நம்ம ஆஃப்லைன் இருக்கும்போது ஷோ டு ஷோ இப்போ கத்தார்லன்னு சொன்னாங்க, ரொம்ப சந்தோஷமா இருக்கு. That is the objective we want to achieve. We want to achieve that shore to shore. Everybody, this what do you say? இது வந்து இந்தியன்ஸோட ஒரு பொக்கிஷம். இது வந்துட்டு உலகம் முழுவதும் தெரிய வைக்கிறதுக்கு, அப்புறம் சஃபரிங் பீப்புளை ஹெல்ப் பண்றதுக்கு, அதுதான் வந்து மெயின் அப்ஜெக்டிவ். I think we have questions. Anybody? Lata Rani, Padma Krishnan பேசினாங்க, ரேஷ்மா, ஸ்ரீபிரியா, உத்ரா. Anybody else have any questions? Otherwise, we can close the session. It was a wonderful session, and I'm so happy, and I express my sincere gratitude for this opportunity, and I welcome you all to continue this journey, and reach out anytime. If you have any questions, don't worry about it. Even if you, there's something happening, you're not able to make it for this course, there are all around the year, there are, training sessions happening. Schedule accordingly and you can be part of it. Stay connected. I am be happy to help you.
Thank you, ma'am.
Sir. Thank you so much. Divya Shekhar, Latarani, Mala Joshi, you have any questions?
Ma'am, good morning, ma'am. Latarani. ஒரு டவுட். ஐம் எம்எஸ்சி யோகா முடிச்சிருக்கேன் TNPSU இருந்து. என்னோட ஃப்ரெண்ட் அவங்கலாம் கேட்டது வந்துட்டு அவங்க ஒரு யூடியூப் சேனல் மாதிரி ஆரம்பிச்சிருக்காங்க. அவங்க சொல்றது என்னன்னா, உடம்பு வந்து நம்ம பிசிக்கலி நிறைய ஒர்க் பண்ணி அப்படியே அதுவே டயர்ட் ஆயிடுச்சுனாக்கா மனசு வந்து கேர் பண்ண வேண்டாம் அப்படிங்கிற மாதிரி கான்செப்ட்ல எப்போ பேசினாலும் ஃப்ரெண்டோட சம் கான்ட்ரவர்சி வந்துட்டே தான் இருக்கும். நம்ம வந்து மனசுதான் ஃபர்ஸ்ட் சொல்றோம் இல்லையா? சோ எதை வந்து இது ரெண்டுமே ஒன்னோட ஒன்னு லிங்க்டு. சோ ஃபர்ஸ்ட் வந்து நம்ம எதை மேம் கேர் பண்ணணும், மனசா இல்ல உடம்பா? அதுதான் என்னோட கொஸ்டின் மேம்.
அது நீங்க சொன்ன மாதிரி ஒன்னோட ஒண்ணு வந்து சார்ந்துதான் இருக்கு இல்லையா? வந்து உங்களுக்கு உடம்பு ஃபிட்னஸ் பக்காவா இருந்தா கூட மனசளவுல உங்களுக்கு வந்துட்டு ஏதாவது ஒரு தொய்வு இருந்துச்சுனாக்கா உங்களால எதுவுமே பண்ண முடியாது. கரெக்டா? அப்போ உங்களுக்கு வந்து வயிற்று வலி இருந்துச்சுனாக்கா வந்துட்டு உங்களால சந்தோஷமா இருக்க முடியாது. சோ இது ஒன்னோட ஒண்ணு வந்துட்டு ரொம்ப சார்ந்து இருக்கு. சோ நான் வந்து இதுதான் சொல்லவே முடியாது. அதனாலதான் நான் இந்த டோட்டல் பிக்சர் போட்டேன். மைண்ட் அண்ட் பாடி, இன்னும் பிரெத் காம்பனன்ட் எல்லாமே சேர்ந்துதான் அது பண்ண முடியும். சோ இப்ப வந்துட்டு பிசிக்கல் ஃபிட்னஸ் தான் பெஸ்ட் அப்படின்னா மென்டல் ஃபிட்னஸ் தேவை இல்லைன்னாக்கா, சாரி டு சே, இன்னைக்கு எவ்வளவு பேரு, எவ்வளவு ஸ்போர்ட்ஸ் பர்சனாலிட்டிஸ், எவ்வளவு வந்துட்டு பீப்புள், எவ்வளவு அழகானவங்க, எவ்வளவு ஃபிட்டானவங்க எல்லாம் வந்து மென்டல் ஹெல்த் ப்ராப்ளம்ஸ் இருக்கு. சூசைட்ஸ் எவ்வளவு இருக்கு. எத்தனை ஆக்ட்ரஸஸ் சூசைட்ஸ் இருக்கு. எத்தனை ஆக்ட்ரஸ், எத்தனை ஸ்போர்ட்ஸ் பர்சனாலிட்டிஸ், எவ்வளவு பீப்புள் வந்து ஹூ ஆர் ரிச் பீப்புள், காசு மட்டும் இருக்குனாக்கா மென்டல் ஹெல்த்னா வந்துட்டு எது இருந்தாலும் அது வந்துட்டு அவங்களால அதை வச்சு அனுபவிக்க முடியாது. அதே மாதிரி வந்துட்டு உங்களுக்கு மென்டலி நீங்க வெரி ஸ்ட்ராங்னா உங்க உடம்பு ஒத்துழைக்கலனாக்கா, எனக்கு மனசுல தைரியம் இருக்கு, எனக்கு பண்ண முடியும்னு ஓரளவுக்கு மைண்ட் இஸ் வெரி பவர்ஃபுல். பட் உங்க உடல் உங்களை அதுக்கு ஒத்துழைக்கலனாலும் உங்களால வந்துட்டு எதுவுமே பண்ண முடியாது. சோ பாடி மட்டும் கிடையாது. தட்ஸ் வை வி டோன்ட் ஃபோக்கஸ் ஒன்லி ஆன் ஆசனாஸ். ஓகே, நான் மெடிடேஷன் மட்டும் பண்றேன்னு மட்டும் பண்ண முடியாது, அதுவும் பண்ணணும். நீங்க மெடிடேஷன்ல உட்காரம்னா கூட உட்காரத்துக்கு உங்களால முடியுமா? உங்களால வந்துட்டு முதுகு தண்டு நேரா வச்சுட்டு தரையில உட்காந்து பண்ண முடியுமா? படுத்துன்னு பண்ணலாம் கூட சொல்லலாம். சில பிராக்டிசஸ் படுத்துன்னு பண்ண முடியும். ஒரு பிராணாயாமம் பண்ணணும்னாக்கா உங்களுக்கு பிசிக்கல் ஃபிட்னஸ் வேணும். ஆசனா வந்து பிரதமாகத்துவம். ஃபர்ஸ்ட் ஆசனால ஸ்டெபிலைஸ் ஆயிட்டு நீங்க பிராணாயாமம் போறீங்க. சோ ஸ்டேஜ் பை ஸ்டேஜ் மனதளவிலையும் உடல் அளவிலையும் உங்களுக்கு வந்து பயிற்சி, இது டோட்டல் பேக்கேஜ். சோ அதனால நீங்க வந்துட்டு வெறும் மனதும் நான் ஒத்துக்க மாட்டேன், வெறும் உடம்பும் நான் ஒத்துக்க மாட்டேன். சோ இட் இஸ் காம்ப்ளிமெண்டரி. ரெண்டு கைகள் சேர்ந்தாதான் வந்துட்டு தட்ட முடியும், ஓசை வரும்.
ஓகே, தேங்க் யூ மேம். ரொம்ப அழகா சொன்னீங்க. ரொம்ப தேங்க்ஸ் மேம். தேங்க் யூ.
பன்னீர்செல்வம் சார், நல்லா இருக்கீங்களா? ஹரிஓம்
மேம். அபிஷியல் குரூப்ல எப்படி ஜாயின் ஆகணும்?
அபிஷியல் குரூப்ல உங்க நம்பர் தரீங்களா? நான் ஆட் பண்ண சொல்றேன். உங்களுக்கு உங்களுக்கு நீங்க ஆல்ரெடி வெபினார் குரூப்ல இருக்கீங்களா?
இல்ல மேம், ஆக்சுவலா இது வந்து எங்க யூனிவர்சிட்டி சார் எங்களுக்கு ஷேர் பண்ணாரு மேம் இந்த லிங்க். அதாவது உமன்ஸ் ப்ராப்ளம்ஸ் ரிகார்டிங் இவங்க சொல்லுவாங்க, நீங்க அட்டெண்ட் ஆகிறது நல்லதுன்னு சொன்னாங்க. அதனால நாங்க அட்டெண்ட் ஆனோம்.
சரி, உங்க நம்பர் தரீங்களா? நான் ஐ வில் டேக் நோட் அண்ட் ஐ வில் ஆஸ்க் them to connect with you.
ஓகே மேம்.
எனக்கு மெசேஜ் அனுப்புங்க சாட்ல. எனக்கு மட்டும் தனியா மெசேஜ் அனுப்புங்க. சாட் இந்த சாட்ல வந்துட்டு 2 இருக்கு பாருங்க, அதுல வந்து என்னோட பேர் மட்டும் வர மாதிரி கவிதா இருக்க மாதிரி மெசேஜ் அனுப்புங்க. நான் வந்துட்டு அதை ஐ வில் கம்யூனிகேட்.
ஓகே மேம்.
ஐ வெயிட் ஃபார் யுவர் மெசேஜ். ஹரிஓம், எப்படி இருக்கீங்க சார்? வெரி ஹாப்பி டு see you. மேடம் இருக்காங்களா? எல்லாம் வந்துட்டு old students, I mean, such star students of Shivadarshan. We are very, very happy and proud of, the service that you're doing. Thank you, Shri Priya ji. Thank you so much.
Thank you, ma'am. Thank you, ma'am.
Message me your number. If you want any clarification, message me your number in the chat separately to me. I will get you connected correctly and give you the information that is required. Mala Joshi ji, do you have any questions? Raji C, anybody, any questions? Divya Shekhar? I would like to end the session if there are no questions and invite you to connect with us. I got Shipriya ji, I got your number. Thank you. Very nice of you. We'll make sure that, I'll get people to reach you.
Thank you.
Thank you. Anybody else? If there is no further questions, I would like to end the session.